Hello and good morning. Welcome to the official YouTube channel of Medfem Women's Clinic. Today it's my immense pleasure to welcome Shraddha Marathe, our new team member and an expert dietitian. She holds a master's degree in dietetics and is an expert advisor for pregnancy, sports and community nutrition. Welcome Shraddha.
Thank you so much.
So today we are going to start a session on nutrition in pregnancy. So Shraddha, tell me, why is a balanced diet important during pregnancy?
Balanced diet, basically, it's a combination of nutrients. So it comprises of carbohydrates, proteins, fats, vitamins, minerals, dietary fiber. And if a pregnant woman is having a well-nourished meals, the upcoming generation will be definitely healthy, and which is a good part on the family also and for the nation also.
Wow, that's a good thing that you had said. So it's very important that a pregnant lady starts a healthy pregnancy with a balanced nutrition. Now there is a myth which patients usually ask me that should I eat for two now that I'm pregnant? Should I start eating twice the amount of meals?
It's definitely not like this. Scientifically, the lady should start her pregnancy with ideal BMI.
Okay, so what is a BMI? What does BMI mean? Please tell our audience.
BMI is basically body mass index. So it's a ratio of your height and weight, and there is a category. So this shows us whether you are into underweight category, you are into normal weight category, overweight or obese category. And surely, if the lady is having ideal weight category, then her pregnancy and the journey which will she enjoy will be at the most important stage of her life, and it will be benefited from.
Absolutely. So I think BMI is the basis which helps us to know whether she is in a healthy, whether she's following a healthy lifestyle and whether she is healthy enough to have a healthy pregnancy and a healthy baby.
And it helps to see that like what will be her gestational weight gain also. Because the entire treatment definitely it depends on that.
Yeah, so we actually ask them to gain a certain amount of weight depending on what BMI they start. So if they start with the obese category or the BMI is higher, then they start the pregnancy. The amount of weight gain that is advised during pregnancy is much less than what a normal healthy woman would gain during her entire pregnancy period. Shraddha, would you let us know what are food groups and how is food divided into certain groups?
See, the food groups basically whatever food we eat around us, it should be seasonal, then local, which will give you ample amount of nutrition also. So those food groups are divided into 4 parts.
Okay.
So our main focus, being an Indian community, we basically eat more of cereals, pulses. So the staple is cereals, so the carbohydrate is the major part. So first group is cereals, millets and pulses. So all this we should see that we are having it on a daily basis. Then second group is basically protein rich, which is plant protein and animal protein, so which has milk and milk products and meat or eggs. Then the third group comes for the vitamins and minerals, which definitely we know the immunity progress, our skin tone, our hairs, everything depends on the vitamins and minerals intake.
Right.
And all the stores, if we reserve properly, then future will be very fit. And
Right.
for that, vitamins and minerals, we have third group, that is vegetables and fruits. And the fourth group is oils, fats and sugars.
Okay. Now, I feel that only a clinician can't give all the dietary advice and, the food choices that a patient can make during a pregnancy. Do you think that, it's important that we have a team?
Absolutely yes. See, what happens like when we are thinking about our fitness, it is always other than medicines also, like your diet, your exercise and your rest also. So all 3 things along with the clinicians' updates, it will help for the better pregnancy
Experience.
experience. And with diet, absolutely the dietitian would be the professional person who will be going to tell the minor changes to major change.
Right.
So as everybody knows, small changes makes a big difference. So this teamwork is very important to make them enjoy this beautiful.
Correct, and have the right advice about what to eat and what not to eat according to their individual pregnancies that they are going through. That brings me to something called high-risk pregnancy, and a lot of pregnancies nowadays in India experience something called gestational diabetes. The another important medical disorder that patients have during pregnancy is hypertension, and in both these conditions, apart from the medical advice, I think diet and dietary advice plays a major role. So, Shraddha, how do you think nutrition and dietary advice helps patients during these pregnancy-related problems?
For example, for the gestational diabetes, it is just for the short span, we all know, and surely the risk also increases in a future. So to avoid that, if the pregnant lady is following a good nutritional regime, which is basically to control her blood sugar also and the hormonal changes which are happening in her body, that will help her and she will understand how to take care of herself in future also. So we have proper diet plans for the gestational diabetes where one-on-one counseling is very important.
Correct. So
we have to understand their body.
Treatment for every patient having gestational diabetes is very important. That's a very important point. And being a clinician, I can very well tell you that we need the help of a nutritionist or a dietitian whenever we have a gestational diabetes patient, because they need an individualized diet plan to manage their sugar levels. It was a pleasure talking to you, Shraddha, and welcome to Team MedFem. Please look forward to all our future videos where we are going to discuss a lot of things about nutrition in pregnancy, which includes all kinds of myth busting, all advice regarding what to eat, what to avoid, and please drop in your questions so that we can answer them and answer all your queries. Thank you so much.